I'm Michael Abaid.
I'm Julie Olson.
And I'm Pete Nguyen. We attend Bishop O'Connor High School, and today we're talking about STDs.
Now you may wonder what an STD is. An STD stands for sexually transmitted disease, or an infection that can be transferred from one person to another through sexual contact.
Everyone, young or old, rich or poor, sexually active or not, needs to know a few important facts about sexually transmitted diseases.
Now there are many ways that one could catch an STD. Some of these ways are through vaginal sex, anal sex, or oral anal sex.
Sexually transmitted diseases are caused by different infectious microorganisms, including bacteria, viruses, and parasites, which are transmitted through semen, vaginal fluid, blood, or other body fluids during sexual activity.
If you get an STD once and are cleared of it, you can most certainly get it again. You can also have one or more STDs in your body at a time.
Hepatitis B is the only STD for which a licensed vaccine is available.
Teens and young adults represent only 25% of the sexually active population. People between the age of 15 and 24 years old account for nearly half of all STD diagnoses each year.
Although this is true, teens are more concerned about having an unwanted pregnancy than they are with catching an STD. Most STDs are silent, meaning there are no symptoms at all. These STDs can only be diagnosed through testing, so you may be infecting another person and not know about it.
There is currently no cure for STDs caused by viruses.
Viral STDs such as genital warts, herpes, and hepatitis B cannot be cured, but there are symptoms that can be treated. There is no way that you can get these viruses out of a person's body once it has become infected. Bacterial STDs are curable. Bacterial STDs such as gonorrhea, syphilis, and chlamydia are cured with antibiotics. Health problems caused by STDs tend to be more severe and frequent towards women than they are towards men. As a result, many women do not seek care until serious problems develop within their body. It is quite true that most sexually transmitted diseases can become completely cured if they are caught at the right time, at an early stage. And in the treatment may be as simple as a course of antibiotics. However, if left untreated, some STDs can pose a long-term risk to your health and fertility. The sad fact is that certain STDs can even end fatally in death. Syphilis and herpes, for example, are two examples of STDs that can be transmitted through non-sexual activity. The 8 most common STDs are syphilis, chlamydia, gonorrhea, herpes, AIDS, hepatitis, genital warts, and pubic lice. In the United States today, there is a total of 3 million people with STDs. The most infected place in our world is South Africa, with a whopping 48 million cases of STDs. You may have an STD if you have any of the following symptoms: pain or discomfort when urinating, itchiness or irritation in the genital area, lumps on the genitals, discharge from the genitals, or genital sores. Although anyone can catch an STD, the rates tend to be higher among African Americans than white Americans. Blacks remain the most heavily affected by gonorrhea. In 2004, the gonorrhea rate among blacks was 19 times the rate among whites. The rate of chlamydia among black women is nearly 8 times the rate among white women. The rate among black men is nearly 11 times the rate of white men. Now you've heard all the facts about STDs, but the most reliable way to avoid getting an STD is restraining from sexual activity. Thank you for watching our presentation!
I hope you learned a lot about STDs.